I want to take a look now at the real-world implications of that emergency, joined now by Dr. Jonathan Slater, clinical professor of psychiatry at Columbia University Irving Medical Center. Doctor, thanks for joining us on this. We really appreciate it. We know from a Surgeon General report earlier this year that during a disaster, there's always a spike in mental health issues, especially amongst children. It seems as if the difference here with this pandemic is we have disaster, recovery, disaster again. This is a roller coaster ride for so many children. How have you been seeing that reflective in your own patients?
Thanks. And thanks for having me, Yasmin. So I think the pandemic has been associated with multiple losses on levels that have been not seen previously. First of all, loss of life, loss of caregivers, loss of secondary caregivers, loss of school, loss of peer relationships, loss of social services and access to social services, loss of connections with peers, and most importantly, a disproportionate effect on children of youth and more disadvantaged children who haven't had access to the internet, who live in rural areas, or have had struggles that preceded the pandemic. And I think it's important to realize that there were escalating mental health problems that came in the decade that preceded COVID. And now with COVID, these are just being escalated, and it's really come to a tipping point in which providers like myself have been completely overwhelmed trying to address the problems of the children that are referred to us. The emergency room's overwhelmed, the inpatient units are overwhelmed, our intensive outpatient units are overwhelmed as well.
So you lay out a solution in your New York Times op-ed saying more clinicians in schools, more child psychiatrists, better screening, more crisis services, and 72-hour emergency evaluation units, more inpatient beds, and intensive outpatient programs. How would that help? What could that do, especially when we look at the long-term effects of this pandemic on kids?
So the mental health infrastructure can't manage the increased demands that have been caused by the pandemic, children with mental health problems, anxiety, and depression. So there need to be more services in between simply outpatient providers and inpatient units and emergency rooms. And that has to take place by better screening in schools, better school-based mental health, better integration between pediatricians and mental health providers in their offices, and better services that treat outpatients, that are more seriously mental ill, that allow them to have more frequent visits with providers like myself.